Dogs are our family. They bring so much joy and balance to our lives. As their pack leader, your most important job is to protect them. One of the biggest dangers for a young dog is a virus you might have heard of, Parvo. Canine Parvovirus is a very serious and contagious disease. It is especially dangerous for puppies who have not been fully vaccinated. Think of it like a powerful storm that can hit a small, unprotected house. An older, stronger house might stand, but a new one needs strong walls. For a puppy, that wall is their immune system, and Parvo tries to knock it down completely. It is our responsibility to build up that wall for them before the storm arrives. So, what exactly is this virus? Parvo is an invisible enemy that attacks a dog's body from the inside. It targets the fastest-growing cells it can find. In a young puppy, these are the cells in the bone marrow and the lining of the intestines. The bone marrow is where the body makes its white blood cells, the soldiers that fight off infection. The intestinal lining is what helps your dog absorb nutrients and water from food. When Parvo attacks these two places, it leaves the puppy defenseless and unable to get the energy it needs to survive. This is why puppies between 6 weeks and 6 months old are the most at risk. Their immune systems are still developing, making them an easy target for this aggressive virus. The way Parvo attacks the body is what makes it so deadly. First, it destroys the lining of the gut. Imagine the inside of your dog's intestines as a soft, absorbent sponge. Parvo turns this sponge into a raw, bleeding wound. This causes severe, often bloody diarrhea and vomiting. The dog cannot keep any food or water down. At the same time, the virus is also attacking the bone marrow. This stops the body from making new white blood cells. Without these cells, the puppy has no army to fight the virus. The damage to the intestines then allows bacteria to leak from the gut into the bloodstream, causing a massive infection that the puppy's weakened body cannot handle. One of the biggest challenges with Parvo is how it spreads and how tough it is. The virus is incredibly resilient. It can live in the environment for a very long time, sometimes for a year or more. It can survive in the soil, on a food bowl, on a leash, or even on your shoes. A dog gets infected by coming into direct contact with an infected dog, or, more commonly, by sniffing or licking a contaminated surface. Imagine walking your puppy in a park where an infected dog was just 1 week ago. The virus could still be waiting in the grass. It is also resistant to many common cleaners and disinfectants. This is why it's so easy for the virus to spread and so hard to get rid of once it's in a place. As a calm, assertive pack leader, you must always be aware of your dog's energy and behavior. A sudden change is a signal that something is wrong. The first signs of Parvo are often subtle. Your puppy might seem tired and not want to play. This is called lethargy. They might lose their appetite and refuse their favorite treats or food. A fever might also develop. These early signs can look like many other less serious issues, but with Parvo, things get worse very quickly. This is your first and most important window to act. Trust your instincts. If your happy, energetic puppy suddenly becomes quiet and withdrawn, you need to pay close attention. This is your dog communicating with you in the only way it knows how. After the first signs, the more severe symptoms usually appear within a day or two. This is when you will see the classic signs of Parvo. Your puppy will likely start vomiting. They will have severe, often bloody diarrhea that has a very strong, distinct smell. The combination of vomiting and diarrhea leads to extreme dehydration and weakness. Your puppy will look very sick and may not be able to stand up. This is a medical emergency. The virus is now in full attack mode and every single minute counts. Quick action is not just important, it is the single biggest factor in whether your puppy will survive. Do not wait to see if it gets better on its own. It will not. When you see these signs, you must contact a veterinarian immediately. Call them on the way to the clinic and tell them you suspect Parvo. This is important because they will need to prepare for your arrival to prevent spreading the virus to other dogs at the hospital. When you get there, the vet will start with a physical exam. They will check your puppy's gums, temperature, and listen to their heart. They will feel the puppy's abdomen, which is often painful. To confirm the diagnosis, they will usually perform a simple and fast test. It is called an ELISA test, and it works much like a home pregnancy test. A small stool sample is used, and it can detect the virus particles within minutes. This quick diagnosis is critical because it allows the veterinary team to start treatment right away. Sometimes the vet might also recommend a blood test. This test, called a complete blood count or CBC, can show if the puppy's white blood cell count is very low. A dangerously low count is another strong indicator of a parvo infection. It also helps the vet understand how severely the puppy's immune system has been damaged. Knowing these details helps them create the best treatment plan. Getting a clear diagnosis is the first step on the road to recovery. It moves you from a place of fear and uncertainty to a place of action and hope, where you and the vet team can work together. There is no magic pill that kills the parvovirus. Instead, treatment is all about supportive care. This means the veterinary team works to support the puppy's body while its own immune system fights off the virus. Think of it like this. If a house is in a hurricane, you can't stop the wind, but you can board up the windows, fix the leaks, and support the walls until the storm passes. That is what vets do for a puppy with parvo. The puppy is usually hospitalized and placed in an isolation ward to keep other animals safe. This is the most important part of the treatment. Trying to care for a parvo puppy at home is incredibly difficult and often not successful because they need constant 24-hour medical attention. The cornerstone of supportive care is aggressive fluid therapy. Because of the vomiting and diarrhea, puppies with parvo become severely dehydrated very quickly. This can lead to shock and organ failure. Vets give them fluids through an intravenous or IV catheter. This rehydrates the puppy and helps maintain their blood pressure and circulation. The IV fluids can also be used to give the puppy other important things like media group, veterinarian adding electrolytes to IV fluids, close-up of electrolyte solution bag next to puppy at stock at distribute _equally, electrolytes to keep their body chemistry in balance, and dextrose to provide a source of energy when they are not eating. This constant flow of fluids is a lifeline that keeps the puppy's body going while it is too sick to do it for itself. It is a constant, steady stream of support. Veterinarians will also give the puppy several types of medications. Since the virus has destroyed the gut lining, bacteria can leak into the bloodstream, so powerful antibiotics are given through the IV to prevent a deadly secondary infection called sepsis. Anti-nausea medications are also given to control the vomiting. This helps the puppy feel more comfortable and reduces fluid loss. It can also help them get to a point where they might be able to start taking in small amounts of water or food by mouth. Pain medication might also be used, as the intestinal damage can be very painful. Each medication is a tool the vet uses to manage a specific problem, giving the puppy the best possible chance to heal. Throughout the treatment, which often lasts for several days, the puppy is monitored very closely. The veterinary team will watch their temperature, heart rate, and attitude. They will check to see if the vomiting and diarrhea are getting better. They will also do regular blood tests to see if the puppy's white blood cell count is starting to rise. This is a great sign that the bone marrow is recovering and the immune system is starting to win the fight. The goal is to support the puppy until its body is strong enough to start eating and drinking on its own again. This is a tough battle, but with intensive veterinary care, the majority of puppies who are treated can and do survive. As a pack leader, the best way to deal with a threat is to avoid it completely. When it comes to parvo, prevention is everything. The single most effective tool we have is vaccination. The parvo vaccine is a core vaccine, meaning every single puppy should get it. Puppies get a series of shots, usually starting when they are 6 to 8 weeks old. They will get a booster every 3 to 4 weeks until they are at least 16 weeks old. It is so important to finish the entire series of shots. A single shot is not enough to provide full protection. Think of each shot as adding another layer to your puppy's shield. Only when the full series is complete is the shield strong enough to protect them. Until your puppy has finished their entire vaccine series, you must be very careful about where you take them. Their immunity is still building, so they are vulnerable. This means you should not take your young puppy to places where many dogs gather. Avoid dog parks, pet stores, and other public areas. When you go to the vet, carry your puppy in your arms instead of letting them walk on the floor. It is okay for them to socialize with healthy, fully vaccinated adult dogs you know in a safe, clean environment like your own home or backyard. This period of caution is short, but it is critical for keeping your puppy safe while their defenses are being built. Beyond vaccination and avoiding exposure, keeping a clean environment is also key. If you are bringing a new puppy into a home where there has been an unknown dog, or worse, a dog with parvo, you must clean thoroughly. Parvo is a tough virus that is not killed by most household cleaners. You need to use a specific disinfectant that is proven to kill parvovirus. A diluted bleach solution is one of the most effective and affordable options. Make sure to clean all surfaces, including floors, crates, food and water bowls, and toys. If an area cannot be bleached, like a grassy lawn, it may be unsafe for a puppy for over a year. Always ask your vet for advice on how to properly disinfect your home. The thought of parvo can be scary, but I want you to feel empowered, not fearful. With the right knowledge and actions, you can protect your dog. Remember the key things. Vaccinate your puppy on schedule, be careful where you take them before they are fully protected, and watch for any signs of illness. If you ever suspect something is wrong, call your vet right away. Quick action saves lives. For more information, you can always talk to your veterinarian or look at the websites for the American Veterinary Medical Association, or AVMA, or the American Kennel Club, or AKC. By understanding the rules and providing calm, confident leadership, you can ensure your puppy grows up healthy, balanced, and safe.